Hi, my name is Haley Smith and I'm a physical therapist here at Maury Regional. I'm here today to talk to you about your new joint. Here at Maury Regional, we strive to be a destination location for orthopedic and total joint surgeries. We want to provide you with education about your new joint in order to set you up for success following your surgery. Today in this video, we will be discussing the anatomy of your hip and knee, what happens in surgery, exercises to perform at home prior to your surgery, what to expect following your surgery from your nurse, physical therapist, and occupational therapist, as well as what to do following discharge from the hospital. In the picture, you will see a model of your hip and your knee. During a total hip surgery, your doctor will be replacing the socket part of your pelvic bone and the ball part of the top of your thigh bone. During a total knee surgery, your doctor will be replacing the bottom part of your thigh bone and the top part of your lower leg bone, as well as smoothing around the back side of your kneecap. Your doctor may use the Mako robot to assist during your surgery. This video shows the surgeon using the robot to assist during your surgery. Exercises are important to do both before and after your surgery. By doing exercises prior to surgery, you begin to strengthen the muscles around your hip joint and knee joint. You will see on the screen an exercise program that we would like for you to start doing today. The goal is for you to do your home exercise program 2 times per day, every day between now and your surgery. You will begin by doing 10 repetitions of each exercise and increase the repetitions up to 15 or 20 as the exercises begin to feel easy. If you are having a total knee, you will be getting a nerve block during surgery to assist with pain control. It is similar to when you have numbing medicine at the dentist for dental work. The anesthesia team will be placing numbing medicine into a nerve on the inside of your leg. This will help to control pain along the front of your leg and the front of your knee. This nerve block does not affect the back of your knee. The nerve block will wear off over 12 to 24 hours after it is placed. When you wake up from surgery, you may have very minimal pain, and that is due to the nerve block. As the nerve block begins to wear off, you will start feeling more pain. This is when you will need to be sure to ask for pain medicine. You will likely have spinal anesthesia, and when you awaken following surgery, both of your legs will feel very numb. The anesthesia begins to wear off quickly after your surgery. With a spinal, your bladder is often one of the last pieces to get the feeling back. Following surgery, you may have some incontinence, which is normal. To help with this, we will provide you with the necessary undergarments following surgery. When your surgery is completed, you will spend 45 minutes to 1 hour in the recovery room and will then be moved to your post-surgical room, either on the same-day surgery unit or on the orthopedic floor, depending on if you are going to discharge home the day of surgery or stay overnight. Once your anesthesia has begun to wear off, your RN will begin to get you ready to get out of bed and prepare for physical therapy. Your nurse will be assisting you to get out of bed, go to the bathroom, and get dressed. Physical therapy will begin within a couple of hours of completion of your surgery. To begin, the therapist will be asking you questions about your functional level prior to surgery. The therapist will be asking you about your walking. How far could you walk? Did you need to use any type of assistive device prior to surgery? The therapist will also be asking about your home. Do you live in a 1 or 2 story home? Which level of your home is the main bedroom and bathroom? Do you have steps to enter your home, as well as how many steps, and do the steps have a handrail? The therapist will also be asking about your help at home. Who will be there to help you, and how often will they be present? The physical therapist will review the exercises you have been doing prior to your surgery and go through the exercises with you following your surgery. We will be following a protocol set by your physician and educate you on any range of motion limitations you may have following your surgery. Your physician's protocol may also include using a knee immobilizer following surgery. The therapist will educate you on proper wear of the immobilizer during your PT session. The physical therapist will teach you how to properly use a rolling walker for ambulation. Following your surgery, everyone is going to have a goal to walk 50 feet the day of your surgery. Your therapist will be assisting you to walk following the surgery. If you have stairs in your home, your therapist will also be teaching you to go up and down the steps. Following surgery, there is a proper sequence to go up and down the steps in order to utilize the strength of your non-operative leg on the steps. When you are going up the steps, you will be going up leading with your good side or your non-operative leg. You will end with both feet together on the same step. That way, when you are ready to go up the next step, you can lead up with your good leg. It is just the opposite for going down steps. When you are going down the steps, you will go down the steps leading with your bad leg or the operative side. The reason your bad leg goes down first is so that your good leg can do the work of lowering you down the steps. You will again end with both feet on the same step. That way you can lead down the next steps with your bad foot first. We want you to remember the saying for going up and down the steps: up with the good and down with the bad. Throughout your physical therapy session, we will be educating you on your home exercise program, ice use at home, home safety, and mobility at home. It is important that you keep moving when you get home. Following any surgery, you are at risk for pneumonia as well as blood clots, and mobility is key to prevent these post-op complications. Hip replacements can be performed two ways: anterior approach and posterior approach. Depending on the approach to your hip surgery, as well as your physician's protocol, you may or may not have precautions or movement restrictions following your surgery. During your therapy following surgery, your therapist will review the precautions with you if you have them. There is a kit you can get prior to surgery which will help you in your activities of daily living. This kit contains adaptive equipment to help increase your independence following surgery. The kit consists of a reacher, grabber, sock aid, long-handled sponge, long-handled shoehorn, and a dressing stick. These items allow you to complete your activities of daily living independently. These items can be purchased at our hospital gift shop, Amazon, or at your local pharmacy. When you are at home, it is important to continue to use ice on your new joint. Ice will help with pain and swelling. While you are at home, place ice on your new joint for 15 to 20 minutes at a time and repeat this every 1 to 2 hours. It is important to continue to work on your range of motion following surgery and discharge from the hospital. If you are having a total knee, the position of your leg is very important. We do not want you to place a pillow under your knee for prolonged periods of time, as this places your knee in flexion and can cause tightness in your hamstring muscles. You can place a pillow under your ankles, just not under your operative knee. When you leave the hospital, the care managers will help arrange continuation of physical therapy, either with outpatient physical therapy or home health therapy. Maury Regional offers both home health services as well as multiple outpatient locations where you can continue your therapy following discharge. Thank you for taking the time to learn more about your new joint as well as what to expect following your surgery. Have a great day.